Hi, my name is Christine DiCarlo, and I'm with the American Association of Colleges of Osteopathic Medicine, and I'm joined with Kaeppler, who is going to be speaking with me today about her experience as the Osteopathic Health Policy Intern with ACOM, and a little bit about Ed2Med and Advocacy. Katie is a fourth-year student at the Kansas City University Medicine and Biosciences. So Katie, my first question for you is, do you have a favorite medical show, and if so, why?
I do. I love Scrubs. That's probably my favorite one because it's hilarious, and I also think it's the most realistic. I like House, but I think sometimes they get a little over dramatic with their show.
Yeah, House can definitely get really dramatic.
Yeah.
So as ACOM's current OE, or Osteopathic Health Policy Intern, you spend part of your internship focused on an area of health policy interest. Could you please describe what you're investigating while with ACOM?
Yeah, so my project while I'm the health policy intern, I'm looking into what influences medical students to go into primary care, and in particular, what drives them to go into care in rural or underserved areas. As you probably know, there's a primary care shortage in the United States right now, and it's expected to get worse over the next 5 to 10 years. So I'm interested in kind of what's driving that, and then also how the health disparities caused by the different distribution of providers across rural and underserved areas plays into that as well, because people in those underserved areas experience the shortage more than just the average American does.
Great, very interesting.
Yeah.
So what are some insights that you can share about what you believe influences medical students to pursue primary care in these rural and underserved areas?
So I think there's a lot of things. I personally am going into primary care. I'm a fourth-year student, like you mentioned, and I'm planning to do pediatrics next year. So I did it because I love the kids, and I think I have a lot of classmates who pursue primary care for similar reasons. They like the population, they like the type of work environment they get to be in. But I've also had some classmates that have expressed concerns or reasons that have driven them away from primary care or going to an underserved area. So one of those is student debt. It's a big issue right now. A lot of students, once they reach their third or fourth year of med school, have $200,000, maybe even $300,000 worth of debt. And primary care specialties tend to be on the lower end of the income spectrum. So it's kind of hard when you're picking that specialty and faced with that amount of debt to say, okay, yeah, I think I can manage it, when you're not sure what your financial future will look like when you're up against that amount of money. So that plays into it. And then I think also, especially for the rural and underserved care part, we just don't get a lot of experience as medical students in those rural or underserved areas. A lot of medical schools are based out of big academic centers, and those are usually based in urban areas. And those are great places. They definitely play a really important role in the medical system. But also, if that's what you tend to see, I mean, that's all you know, especially if that's what you did during medical school and during residency. And I always like to think that humans are kind of creatures of inertia. We kind of do what we know, and we'll just stick with that. And so if you start somebody in a big academic environment, they tend to keep following that path because that's comfortable and that is something that they have good experiences with. But if you don't expose people to rural and underserved care, it's hard for them to imagine what practice might look like in those kind of settings. So I think that we don't do a good enough job right now of getting people into those exposures out into the rural and underserved areas, and I think that if we did, maybe a lot more students would see that as a viable opportunity for their practice in the future.
Interesting. So yeah, a mix of experience and maybe balancing passion with a future earning potential.
Exactly, yeah.
So the next question, I'm going to go a little bit deeper into the Ed2Med campaign.
Yeah.
So Ed2Med was designed to protect federal public service scholarship and loan forgiveness programs. For example, the Public Service Loan Forgiveness, or PSLF program. How do you think programs such as PSLF help address our physician workforce shortage, particularly in these primary care fields in rural and underserved areas?
I think programs like PSLF are really important for encouraging students to go into primary care, and especially in those underserved areas. So for a number of reasons. The first one is when a student is making their career choice, either what specialty they're going to go into, or maybe at the end of residency where they want to practice. Programs like PSLF really help take the debt out of the equation for students. Like I was saying before, a lot of people are graduating with these huge amounts of debt, and usually by the time you're done with med school, you're probably close to your 30s. You did 4 years of undergrad, 4 years of school, at least 3 years of residency. And so now you're at the age where you're thinking, well, maybe I'm starting a family, or I want to buy a house, or save for retirement, you have other financial goals, but then you also are saddled with this huge debt from your education. And so when people pick their practice location, that kind of weighs in whether, a lot of us went into medicine because we want to serve people and we want to take care of people. But when the financial realities that you're facing right now come up against maybe what was your dream when you started medicine, it's kind of hard to balance those. And so PSLF is really important for just taking that out of it and letting people maybe pursue the type of practice that they've always wanted to do without worrying about their own financial security. So it's good for the students, but it's also good for hospitals, because a lot of the hospitals that PSLF and programs like it are trying to drive students towards are the same hospitals that are in really cash-strapped areas. They don't have a lot of extra money to recruit quality providers. So they can't compete with private hospitals on just a salary basis alone. So PSLF kind of levels that playing field between these underserved communities and the hospitals that maybe have an easier time drawing people in with big salaries, big benefits, etc. So it makes it easier for students, again, to choose those hospitals, but it also makes it easier for hospitals to bring those students in.
Makes sense, yeah. Definitely benefits different groups.
Yeah.
So to go back to your internship role, for the OP program, in your first OP blog post, you described your desire to become a more engaged advocate. What's one thing a new advocate can do to get more involved?
So my main advice for people new to advocacy is to give yourself permission to start small. I think a lot of people, especially med students who are kind of all or nothing about everything that they do, tend to think, oh, I need to know everything about every issue and I need to be so involved. And that can really be discouraging because there's a lot going on and politics moves very quickly. And so I would say if you're new to advocacy, just pick one thing that you're really interested in, something that you're really passionate about. And then try and look into it, do a little bit of research. If you can find programs like Ed2Med that give you really great information, they give you toolkits, even present you with opportunities for advocacy, that's really helpful to kind of direct your search as you sift through everything that's going on in Washington. And then to kind of follow along with that, when you do get opportunities for advocacy, I would say don't be too scared to do them. I know before I did this internship, I was a little bit shy, I guess, about advocating, or a little hesitant, because I kind of felt like any sort of message that I sent out was just going into this void. And send it to Washington and then who knows what happens with it there. But what I've found when I'm here is that there are people on the receiving end who really do want to hear from you and they care about what you have to say. I mean, congressmen and women are just people like you and me, and they can't know everything about everything. So they depend on messages from their constituents to hear, well, this is important to us, or you need to protect this or get rid of this, etc. And so it really matters. Your voice matters, and I think it can be hard to see that kind of in the grand scheme of things, but I want to encourage people to participate because somebody is listening and your voice does matter for those things.
Thanks, Katie. And I would also encourage you, if you're interested in advocacy, to visit ed2med.com. And you could also follow us on Twitter at ed2med, and we're on Facebook at ed2med too. And for my last question, can you tell us one fun fact about working in Washington on health policy issues?
Yeah, so this is my first time spending a while in Washington, so one thing I really wanted to do when I got here was to see all the Smithsonian museums. And I was especially excited about the Natural History Museum. And I found, sort of by accident, that Monday is field trip day to the Natural History Museum. So it's great if you want to share your experience with 100 million children, but even as a budding pediatrician, that was kind of a lot for me. So I think maybe I'll try visiting on a different day in the future.
Yeah, avoid Monday. Also avoid weekends. I'd recommend that.
True.
All right, well, thank you so much, Katie. Thanks for watching.
Yeah, thank you, Christine.